Good morning, one and everybody. At the outset, I like to thank the PCOS Society for giving me this opportunity, in particular, Dr. Durusha and Dr. Madhuri Patil. And also, I'm very thankful for Ratnabali Chakravarti Madam for your kind introduction. I'll be loading my slides. Is it visible, madam?
Yes, it is visible.
Okay, fine. Yeah. So does PCOS induce early or a delayed menarche? That's the question I have to answer in this talk of 15 minutes. So this is my opening thoughts. Girls with PCOS exhibit a wide range of age at menarche. There are studies to suggest it occurs early, and there are many studies to suggest it occurs even in the late. And it has been found that girls who have been diagnosed with PCOS can present as a primary amenorrhea till to the age of 16 years. On the contrary, some PCOS girls experience a premature puberty and early puberty. And what has been very well clearly seen that higher weight is associated with the earlier age of menarche, what we call it as a Fish hypothesis. And one more other thing on the contrary has also noted, girls with small for gestational age, born with less than 2.5 kgs or even less than 2 kgs, they have a menarche earlier if they rapidly gain their weight during their childhood ages. Now the question comes, what is a early and what is a late? This confusion exists across the spectrum, across the specialties, and the normal age of menarche has been said in all the texts and everything. There is some amount of a secular trend in decrease in the age of menarche that has been noticed across the globe, and it is happening more and more in the developing countries like Asian and African countries. To evaluate this, what is the age of menarche in our population? We did a study in our St. John's and we presented this in our ESICON conference. Dr. Ganapati, who is ASI president, is also part of this study, and our postgraduate, Dr. Spurti Pai, who is a consultant now, did this study. This was just a study to assess the relationship of a maternal age at menarche, socioeconomic status, anthropometric measurements, in particular the weight and the BMI, birth order, and also physical activity and the dietary habits. And also we wanted to know what happens to the secular trend, those who are born before 70, between 80 to 90, and 90 to 2000 and above after 2000. So what we found that mean age of the people who studied, this was an observational study which was based on the questionnaires. All the females who had achieved menarche were part of this study, and it was mainly the employees of our St. John's Medical College. So mean age of menarche was 13 years, but we wanted to look into what happens to the secular trend. So we divided into the tertiles, those who were born before 1970, between 71 to 1980, and 1981 to 1990, and before 2000. And we found that there was not much of a significant difference in age of menarche in our population, especially the educated population, and somewhere even uneducated when we took a class 4 employees. So we didn't find significant difference of a secular trend in decrease of age of menarche, with the mean age of menarche being around 13 years. And we also got some important highlights from this observational study. There was a positive correlation between the age of menarche of the daughter and the mother. And there was no significant correlation between age of menarche and the birth year, that is the before 70 or between 80 to 90 or 90 to 2000. And also there was a positive correlation between age of menarche of daughter and age of menarche of the mother. And there was no difference in the age of menarche with the educational or a marital status. So these were the important highlights. That's why we know that there is not much of a secular trend we observed in our population, what we studied in St. John's. Then the question comes, what is the age of menopause in our group? I think this is our own study. This I was part of my DM thesis when I was doing my DM in BOL Nair Hospital under our Madam Prema Vartakavi. This was the leptin levels in the PCOS and its response to metformin therapy. This was a broad heading of the study, but in that we had 20 subjects of a PCOS and 19 BM and age-matched controls. And we evaluated PCOS, we put them on the metformin, we evaluated the baseline and also after therapy matters, after therapy parameters. And what we found in our PCOS group, which were studied, this was done in 2001 and 2002, it was around 13.55 years. Compared to the study group which I had done during my DM and also nearly 1.5 decades afterwards in Bangalore, almost there is no significant difference in age of menarche we noticed. So our PCOS group, which we studied in Western India, that's Mumbai, was around 13.55 years in year 2001 and 2002. Then we look into certain international publication which have addressed this. So this is the study from the human reproduction published in way back in 2003. This was a retrospective cohort of nearly 26,000 women who were diagnosed with the PCOS between 1980 to 1995. They divided them to the 3 study groups. One reference group were defined from using data from their medical records. And this was mainly done in a fertility center who seek for a consultation for infertility. They divided them as a reference group from their records, PCOS, patients who required oocyte donation, and those who didn't respond very well on a IVF therapy. What they observed in their study is menarche age, whether it's an early or a late. The early they defined anyway, anytime before 11 years, and late they defined after 15 years, and between 11 to 15 they took as a normal age of a menarche. And the study highlights where the older age at a menarche, there was a greater risk of a PCOS, whereas young age at menarche was significantly associated with the strong indicators of a diminished ovarian reserve who responded very less on IVF therapy. And one important thing they noticed, there was a strong association was found between diagnosis of a PCOS and an experience of a menarche. That's the first menstruation after the age of 14 years. So this study almost suggested PCOS do have a delayed menarche. Then we know that there is not only a genetic factors which are important, there are lots of environmental things which are important for the menarche. This was been evaluated in this paper from Jessica Carroll's group that is published in Journal of Pediatric Endocrinology and Metabolism, wherein they studied PCOS group and a control group. They given the time, the birth weight, birth order, pubertal development, age of menarche less than 10, 11, 12, 13, 14, above after 15 years. And also they found that the age of menarche in the PCOS group was almost correlating in certain group with the control group when it comes to the different age groups. And they opined age of menarche in women with PCOS is influenced by both low weight and high weight. In the both spectrum of weight, there is some amount of menarche influence. There is also not only a weight, there is lots of genetic influence for the age of menarche. But they came out with the 2 important scenarios which we are witnessing even in our clinical practice. One is influenced by the overweight at the time of puberty. Another is weight is lower, but menarche is also later. So that early puberty is associated with most of the time overweight, sometimes even they are lower weight with the later part of the menarche. But these were all the observational and studies, but this is the one study which looked into the cohort of the people which they followed for nearly 26 years. I think 26 years is a huge duration. They wanted to see the early and the late menarche in association with the oligomenorrhea and whether this can predict the metabolic syndrome and the oligomenorrhea. These are, I think, hallmarks of the PCOS. So the objective of their study was clinical information on late or early menarche could help to identify adult women with a metabolic syndrome and oligomenorrhea. I think mostly it is they are more interested in the cardiometabolic aspects. They carried out 26 years of a prospective follow-up involving 272 suburban schoolgirls from the ages of 5 to 20 years, and subsequently they refollowed for 30 to 46 years. And they divided again the menarcheal age category: early less than 10 years, normal between 11 to 15 years, late after 16 years. And they compared with the different races. Oligomenorrhea they defined as more than 42 days, any metabolic syndrome features, and also IFG, hypertension, type 2 diabetes, number of pregnancies, and number of live births. What they found that when they looked into the oligomenorrhea, that is defined as more than 42 days, those who had a menarche less than 10 years, that's an early menarche, and also those who had a late menarche, that's more than 16 years, there was very, very well associated. They suggested there is a U-shaped relation between age of menarche and a oligomenorrhea risk or a metabolic syndrome risk that is suggestive of a PCOS. So the outcome of this longitudinal study involving 26 years or later showed that timing of a menarche can help to identify adult women who are at risk of a later metabolic syndrome and oligomenorrhea. That is one of the phenotype of a PCOS we have got. Early menarche and late menarche are both early warning signs for adult cardiometabolic abnormalities, which includes even the oligomenorrhea. So that's why one of the very, very offshoot of their study was this will help to identify pediatricians so that they can associate the adolescent risk factors with the early and the late menarche. And also this can provide an opportunity for a primary prevention in a young adult for a cardiometabolic risk abnormalities, which can be presenting in the later part of their life, that is 4th decade or 5th decade. So these were the important studies which were suggesting about the age of menarche and the PCOS. So what we can derive from this is menarche in girls with the PCOS can exhibit a much wider age range. It can range from yet or before the age of 9 years to a primary amenorrhea of more than 15 years. There is a strong and inverse relationship between the age and the weight at a menarche. Overweight may play a greater role in those who have an earlier menarche, but those who present with the later menarche are of the mixed group. Some are obese, some are on the leaner side. That's why, because it's a very wide range of illness with lots of inclusion and exclusion factors, more and more work is needed to understand age of menarche and the future cardiometabolic risk in patients with PCOS. Thank you for your patient hearing. Here I end my presentation.